Alrighty, it's 1 o'clock, and for those of you that know me, I'm try to be very prompt. So let's go ahead and get started. A couple of housekeeping things before we begin. Please do ask any questions that you have in your handy dandy questions box. That will be very helpful for us at the end, and I'm certainly happy to answer as many questions as people have until we run out of time. If you'd like to tweet, please use @Aha Media Group, if you still go on Twitter. You will receive an access to this recording and the slides, as well as a link to the free gift, which we will give you at the end. And if you have any topics that you would like us to cover in the future, please do let us know either by email or by putting something in the question box or by the survey that you'll get afterwards. It's really helpful for us to know what's in the minds and hearts of the healthcare marketing community. And obviously, every topic that we research for these webinars is something that we get to learn about as well. So we're always happy to hear suggestions from our audience. So just before we begin, a little bit about Aha Media Group, in case this is the first time you've ever encountered us. We are a communications firm that's focused in the healthcare space, and I am the founder of the company. Aha is a play on my name, Ahava. And our goal is to empower people to make the most important decisions of their lives. I myself had a healthcare crisis, and having to go online and research that information terrified me. And I really wanted to create an agency where the foremost priority was focusing on the patient and the patient family and creating empathetic content that could center on their needs and what they really needed to make an important healthcare decision. Just quickly, this is not a sales pitch, just letting you know what we do. We do content strategy and creation. So content strategy could include, competitive gap analysis, audits, editorial toolkits, brand editorial strategy, personas, things like that. Content development is any copy you might need, podcasts, blogs, social media. And then content training, we do offer very popular now virtual workshops for your team, including writing for the web, voice and tone, content workflow creation, which obviously as we've become distributed workforces is very important, and also teaching your physicians how to use social media effectively, if using social media effectively is still a thing. So please feel free to reach out if you're interested in any of those trainings. We also offer many COVID-19 resources, including some plain language cheat sheets, as well as a video series where I interview people every week about what they've learned since the pandemic started. This includes healthcare marketers and communicators, as well as other marketers in the field. Again, if you are interested in being interviewed for that, please do let us know. We're always looking for interesting people. I don't want you to watch these and think, oh, that person's a CMO, oh, that person's considered an expert. I want to hear from everybody. Our audience can learn from everybody. And so please do raise your hand. You probably have more important things to say than you realize. All right, that's about Aha Media Group and all the stuff we do. Now let's get into the stuff that you do. So let's talk about telehealth, because now marketers, like you didn't have enough to do, now you have to focus on really promoting telehealth for the health of your organizations, because we know that hospitals ran out of cash when people stopped going to see doctors. And telehealth was really something that sustained them by being able to provide care for people while they were locked up in their homes or quarantined. So we developed 7 best practices for long-term marketing success that we wanted to talk to you about. So, it's always fun when we start these webinars to kind of put the entire situation into context. So telehealth visits increased 154% the last week of March 2020. I don't think any of us have to be reminded what happened 7,000 years ago the last week of March, but we know that that was really when the entire country went on lockdown and people really needed to access these health services. You can't wait for some of them. I think it was very interesting, this talks about like vocabulary and terms that we use, but I remember when people would talk about elective surgeries and being inside of healthcare, a hip replacement doesn't feel like an elective surgery to somebody who has terrible arthritis and can't move around. So it was really important that people were able to access, at least for chronic conditions and things like that, primary care. Also finding out if they had COVID was very important to them. 83% of patients expect to use telemedicine after the pandemic resolves. I actually had a telemedicine visit today. It just coincidentally worked out. I have a GI condition. Remember, I told you I had a crisis. I had pancreatitis. It's a good story. I'll tell you over a drink one day. it's not such a good story, but anyway, so I was meeting with my GI for my annual meeting, and I was like, this is fantastic. I didn't have to drive into DC. I'm located in the DC suburbs. You know, it was really great, and I would totally use it. Now, a GI really does need to examine you, so it's probably not going to happen like this. They're probably going to require people to come in for those kind of visits. But I do think that more and more patients, when possible, will really adopt telemedicine as a part of their regular health routine. Again, saves people 100 minutes, right? So that's a huge, and it saved me probably more than that. Back and forth, it's at least 2 hours. So this is a really valuable thing, something extra for people that they're going to see as a value add to telemedicine, even though being in the same room as a doctor may have been what they were used to. And this is a really positive result. 93% of people said they would use telemedicine to manage prescriptions. How many times have they told you you need to see the doctor in order to get your prescription refilled? And imagine being able to go on a 30-minute call and have the doctor check off a couple of boxes on the EMR and move along, right? Fantastic experience. 91% said that telemedicine would help them stick to appointments, manage prescriptions and refills, and follow wellness regimens. So again, there's so much fantastic opportunity for us here, and the goal of this webinar is to talk today about how to market it and how to communicate to your patients and your prospective patients about the value that it can bring them beyond the, I need to see the doctor and this is my only way to do it right now. How do you set it up for long-term success and health so that it continues to be a critical service line within your organization? So before we even start with the 7 best practices, I just want to say for the record, where do we always start? We always start with our audience. So one of the things I want to talk about, which I think is a critical thing, is the plain language approach to telehealth and to telemedicine, because in looking at, we did a survey of a lot of hospitals and we looked at a lot of different examples, and it was very interesting to see how people were handling the language around this concept. And so I think it's a good thing to just go back to the basics a little bit. So plain language is language that is plain to one set of readers may not be plain to others. Written material is in plain language if your audience can find what they need, understand what they find, and use what they find to meet their needs. So let's look at what that looks like when we do a Google Trends search. So if you look at this particular slide, and you can do this yourself, you can go to trends.google.com. And when I type in telemedicine, telehealth, virtual visits, video health visits, and virtual doctor visits, which were all examples of the terminology that we found all of you out there using, we find something really fascinating, which is shockingly, I know this is going to come as a great shock to all of you, but people prefer the term they've always known and not the one that sounds fancy in marketing lingo, right? Most people call it telehealth. They don't call it telemedicine, but they don't call it virtual visits, they don't call it video health visits, and they don't call it virtual doctor visits. Most of them prefer telemedicine and telehealth. And you can break this information down by geography. When you type in and Google suggests, Google will tell you some other synonyms for what people are looking for. You can see with the telemedicine, you can get some nice synonyms that people might be looking for when they're looking for this information. And you can also find this in the people also ask. So one of the things that I want to show here is that when you ask it telehealth or telemedicine, you're going to get back different synonyms. So do a search on each of the terms to see what's coming up for the consumers around you. It's clear to me that people need more information about what a virtual visit is and how do I get a virtual doctor visit than they might about telehealth or telemedicine, although that also can be explained. It's actually really interesting. When I did a survey on YouTube and I searched for it, you could find a lot of videos about it, but none from companies that actually sell telehealth services. So I thought that was pretty interesting. And again, I'm tracking certain things on Google sees my URL a certain way. So it may be different for other people, but I do think that that's an interesting thing to think about. So you may have marketed it as virtual visits. Make sure you're using terms like telehealth and telemedicine in your copy and in your metadata in your search, so that people are being brought to your landing pages appropriately. You may also want to think about your Google Ads to also include synonyms that you may not have branded your telemedicine program, but are what your patients are actually calling it. So before we even get into the nitty-gritty of the 7 best practices, get into the minds and hearts of your patients and figure out what languages, sorry, it's Thursday, words are hard. Figure out what terms they're using, what their glossary is, so that you're bringing them down from that search funnel into your program. Okay, sound good? Alrighty. So let's create a telehealth digital health front door. So we've been hearing a lot about consumerism in healthcare. In fact, it was supposed to be the big topic of 2020. Spoiler alert, didn't work out that way. But healthcare is going to have to approach a much more consumerism targeted type of approach in marketing. So what does consumerism says? It says that now it's really easy to do business. Like, think about the way you make an airline ticket. Remember when you used to do that? Or set up an appointment for something else, or shop for your groceries online, or get seltzer delivered to your door, whatever it is. Things are a lot easier for people to do business because of the power of digital communication. And healthcare has not, unfortunately, been able to keep up with that in the same way for a lot of different reasons. And obviously, it would take a lot more than one webinar to address those. But you have an opportunity to use that approach in your telehealth program, because it's something not really new. I know you've all been doing it for a while, but now it's getting a lot of attention. So you now have this opportunity to really make your telehealth, telemedicine a service line, and use that experience to really drive the way that your consumers come at the content. So you can see here that University of Utah Health does a really nice job of just saying virtual urgent care, start your virtual urgent care visit. And they make it really easy to get inside. So that's the front door. Like, imagine walking up to a building and opening it, and they're like, hey, this is where you go to schedule this. You can do it by appointment. You can click on this button, which is probably going to lead to another page that's going to give you a form. And there are also all these fabulous questions at the bottom, which will help me understand what I need to know. This is New Vance Health. So just to be clear, in the spirit of transparency, which we absolutely believe in, authenticity is not just a tactic. These are clients of ours. If you see a star in the upper right-hand corner, this is New Vance Health, and they show what does a virtual visit look like on their homepage when you enter their landing page for their virtual visit program. So again, they make it easy to see what's happening and make it easy to continue with that call to action. This is Texas Children's Hospital. So I think this isn't as pretty, right? And it isn't as well designed, but there is a very easy system for scheduling an appointment. Are you a new patient? Are you an existing patient? And then they're talking about how we're keeping you safe. And obviously this picture with the masks does illustrate that this is something that's happening in our current climate. So what I would say is that if everything's on the same page, design it nicely. I don't know what happened here at Texas Children's Hospital. I know they're probably working on it. But the important thing to remember is that you want it to look like this is a service line, not this is something we cobbled together in March of 2020 because we needed to. You really want to make it look like the landing page that you would for any strategic service line, like cardio, like orthopedics, like women's services, like cancer. It should feel like this is the beginning of your journey interacting with us at this telehealth services, almost like a location, right? Like a retail location, but online. Okay, now we come to the second one, which is provide multiple entry points. So this is really important because you have a big website with a lot of pages and a lot of opportunity for people to do things. And you want to make sure that your telehealth service line is not just contained inside of one service line the way that, like, let's say oncology or orthopedics might be. So here's an example of how George Washington University Hospital does this. This is their landing page for advanced sports medicine, and you can request an appointment here. So this is a way to get into their virtual health services through a specific condition, like your knee is hurting you. This is where you can find out which doctors offer virtual visits. So here I did a search on a particular doctor, and it says make an in-person or virtual appointment. So they're giving people the information on all of these different multiple touch points. We always talk about that three-legged stool of a hospital website: services, locations, and doctors. So in those three areas of that triangle, you want to make sure that people have multiple entry points into your system. Here they do it in the breast care center as well. Virtual visits available. This is for somebody who might be coming in for a mammogram, for a potential biopsy of a lump, for other things. They're letting you know that these virtual care services are available for this service line as well. The University of Vermont Medical Center does the same thing. You literally, I mean, they really got this one done. On the front page, on the home page, you find that information available to you. From the gastroenterology page, you find it available to you. And then this is the home page of that telehealth service line. Now, the one thing that I like about what Unity Point in Iowa does is that they actually have it omnipresent on their website. So I think that they're part of a larger system, but a smaller location. So I don't know if it's on all of their other websites, but I really like the fact that it's just every page you're on, it follows you around, so you know that it's there. What I want to say about doing it like this is that there is one thing you need to think about, and that's your digital footprint. COVID is hopefully sooner than later going to go away, and we're going to resume some normal things. Telehealth is here, and it's here to stay. I don't think we're going to see it fade into the background. But from a content governance perspective, and that means managing your content for the future, you don't want all this COVID content all over your website that you're going to have to then go and clean back up in late 2021 and 2022. So even though we're telling you have multiple entry points, I think the way that these two systems did it was probably to use the dynamics of their content management system and their page templates in order to be able to remove that information once they have no longer need to advertise that. Now, I think you should always advertise virtual visits from now on. I think that always should be available to people to know about. But you do want to be able to go in and not necessarily associate it with, you know, our national or international health crisis or our pandemic or something like that. So just keep in mind the digital content governance, that the footprint you create with your COVID content, you don't want it to tangle into every single page, but you want to somehow have some control over it so that later you can go back in and change it pretty easily without having to touch, you know, many pages at once. All right, now we're going to talk about one of my favorite topics in content strategy, the FAQ page. So there's a lot of fighting about FAQ in the content strategy world. You know, maybe somebody should give them something real to talk about. But there's a lot of argument because here's the feeling. The feeling is if you're going to write content, you shouldn't need FAQ content because your content should answer your FAQs. So when I always teach about writings, conditions, and treatments, I always talk about this idea of a condition page is almost like an FAQ page for that condition. So if you're writing about supraventricular tachycardia, what is it? How do I know? How will I get diagnosed? How does it get treated? Those are all FAQs about supraventricular tachycardia. The reason that people argue about whether or not there should be separate FAQ pages is that they feel it shows a laziness about the content, that you didn't write the content in a way that really answered all of the users' questions on the page that pertain to that topic, and therefore you had to go and create a new FAQ page. I don't agree with that personally. I think that FAQ pages can be very helpful, particularly when somebody wants to dip their toe into a new concept or a new idea. And what's really great about this opportunity with telehealth and telemedicine is that this is exactly what's happening for people. They have to learn a completely new way of interacting with everybody around them because everything's changed. Somebody was talking about how when he went to the hairdresser, he had like 18 different emails from them about what to do. If those had been consolidated into FAQ about coming to us during COVID, it would have made his life a lot easier. So FAQs are very important during telehealth. The other thing I want to say technically about FAQs, which shouldn't really matter to you that much now, but in the future, if you're ever in a hot debate about it, you should know that FAQs are where Google and the other search engines pull a lot of their information for voice search. So they can be helpful from that perspective as well. But back to telemedicine. Here are some examples of where frequently asked questions are handled pretty well. This is from Boston Children's, and they really have what is a virtual visit, how do I schedule a virtual visit. They have a lot of questions here. I might quibble a little with this design. I think it's a lot of things to weave through to find the answer that you're looking for. This is telemedicine at Seattle Children's. I think they do a nice job here of making the frequently asked questions a part of the landing page of the Seattle Children's telemedicine program. And so that's nice. You can just sort of scan down your eye and find the question that's most interesting to you. But I really love the way Sharp does it. I think Sharp does it in a really smart way here. This is the homepage of their telemedicine. Again, this would be that consumerism front door approach. But look at this, where can I go if I need care now? And they sort of answer that frequently asked question of what kind of care do I get with telemedicine? And they explain according to their 3 different service lines, virtual urgent care, and emergency care. So I think that's also a way to handle your frequently asked questions, is to think about ways to display the information through content, but also thinking about it, what's the fastest way we can communicate this information to people using graphics and layout. All right, next of the best practices. So we've seen a lot of urgent care, we've seen a lot of, primary care. What about specialty care? Because one might think you can't really see your gastroenterologist on a telemedicine visit. That might be a little bit difficult. So the organizations that are doing a good job at this are really specifying that specialists are available to their consumers. So this is Mount Sinai, and you can see they divide into urgent care, primary and specialty care, and on-demand care, and they talk about how their specialists are available for these video visits. So this is a nice way to sort of give people this information using this sort of graphical, let's pull the information out and design it so that people can easily find what they're looking for, but also very fast communicate to people. You can't just find your main internist here or your main doctor, but you can also get specialty care, which, we're in a club of people who know what specialists are. And I think a lot of people know what a specialist is, but let's talk about Providence and the way that they handle it. So they talk about express care virtual visits, a virtual visit with any provider for minor immediate health concerns. I know people like the word provider. We've done searches on it. Doctor actually scores a lot higher. Not that that will affect your search so much, but it might make it more simple to just say doctor. Telehealth visits, a scheduled virtual visit with your primary doctor or specialty provider. So here they're talking about the specialists. There might be, the reason that provider might be used is because nurse practitioners or nurses may come on, and that makes a lot of sense to me from that perspective, to use provider for that reason. I really love the way Ortho Carolina handled promoting their telehealth visits. So this is a large practice in the Carolinas, an orthopedic practice. I love what they do in talking about what their specialty care is. Here, we're going to watch, this is a 15-second spot. That's one of the reasons I love it so much. It's short and sweet. Let's watch it together. Oops, that didn't work.
How you doing? I'm Dr. Hammond at Ortho Carolina.
I'm having some pain here in my shoulder.
Let's see how your range of motion looks today. This is where you're having your problem.
Schedule your video appointment today. Ortho Carolina, you improved.
So what I really loved about that was A, it was short, and B, they showed how you could actually have a telemedicine visit with an orthopedic doctor. Like, she holds out her shoulder and he shows her on a scan where the problem is. And I just think, she's doing it from her kitchen, and then she's holding her son afterwards, which is the screen you can see right here at the end. I just think that's so well done. In such a short amount of time, they were able to answer so many of people's questions, like, what is this going to look like? Can you really do this online? This seems like something you'd actually have to touch me for. So that is a great example of how you can communicate really, really fast. That specialty care is absolutely something that can be done online and doesn't necessarily need for your doctor to, as they say, put my hands on the patient, which is something that doctors always talk about as part of what's important to their practice. And if you talk to doctors, they'll tell you this has really revolutionized the way they saw telehealth, because they never thought that they could really practice like this. And this has taught them that for a lot of things they can. They don't necessarily need to see the patient in person. I think for a lot of them, they prefer it. And in the future, I think we'll see that there will be more determinations made about how to use it. But for now, it is working. The next thing I want to talk about is data and research, because I think very often we launch campaigns, we launch services, and we watch them for the amount of the time that the campaign goes on, and then we stop paying attention to it and we move on to the next thing. And of course you do, because you have so much going on and there's only so much of the pie you can split into so many pieces. But I do think that if telemedicine is going to become a strategic service line within your portfolio, then you really do want to think about how to gather as much data as possible to make sure that you keep making it better and that you keep effectively changing the content so that it's powerful and helps your audiences get toward what they want. So we weren't able to necessarily find electronic surveys, because my suspicion is that when somebody gets a text message or an email after an appointment, that's when the electronic survey is sent to them. I didn't sign up for anything, and I still haven't gotten one for my GI appointment today about how it was, but my assumption is that that's how that happens. In this particular ones that we found online, they're printed. I don't know if people fill out a printed PDF and send it to send it back to the provider. My guess would be if they had a really bad experience, you're going to hear from them. But I do think it's valuable to know that people are using these after appointment surveys, which you probably use now anyway, probably a different part of your organization, to try to track how physicians are doing and are appointments being kept on time and what's the cleanliness and the staff and so on and so forth. But you want to do this also, from this perspective, is the technology working properly? Were people prepared properly beforehand? Did they get the instructions that they needed? Was it clear to them to find what they were looking for? Did your doctor do a good job of explaining everything that you needed? Was, she short with you, long with you, whatever it is, you're going to want to gather that data. So I just gave you some examples here of some printed surveys that I found, because I think that these can be really helpful to sort of building your own survey. Now, you may have one. Your platform may have one in it that automatically is sent to people. Make sure you're asking the questions that are getting at the information you need to know. So somebody else may be worried about the technology aspect of what's happening for telehealth. That person should be able to ask those questions, but you may be wanting to get into were you well prepared? Did the content help you? Was there anything that you would have liked to have known before it started? I'll give you an example from what happened to me this morning. They sent me like 3 different emails about it. They made me sign into this portal, and totally fine, but they said you will get a link from your doctor 10 to 15 minutes before your visit starts. And at 10:27, I still didn't have a link, and I kept searching my email and looking at my texts and trying to figure out what was going on. And I didn't get that link until 10:30. So I had called the office between 10:27 and I was on hold until 10:30 to try to get the information for that link. So it would have been better if it had just said, right before your appointment, your doctor will send you a link. Then I just would have known that it was going to come closer to the appointment time instead of 10 to 15 minutes before, and I was worried that I missed something. So making sure that people are filling out these surveys, and that I would send them to them in a way that's as easy as possible for them to fill out from a technology perspective, is going to be critical for you building a more effective communication strategy around the telemedicine platform. All right, leveraging virtual visit reminders. So the most important thing that I think a marketer can do in 2020 and beyond is capture people's information for continued communications with them. That is really what we are trying to do, because through our content and through our marketing, we want to develop relationships with people. We don't want to be annoying. We don't want to be creepy. That's not what I'm talking about. What I'm talking about is capturing their information so that we can communicate with them in a way that they either desire, prefer, or that allows them to opt out. So we want to leverage these virtual visit reminders. Remember, if people went through the trouble to actually ask for the appointment, they really want the appointment, and they're going to give you their email and they're going to give you their text numbers, and you're going to be able to communicate with them about other things. Email can always unsubscribe, text can always opt out. Make sure legal looks at what you're allowing them to sign up for when they sign up for these telemedicine, but make sure that you can still communicate with them, either about that particular kind of visit that they went for, like a GI or an orthopedic visit, whatever specialist, Or even for primary care, you can now send them your primary care newsletter. You can now send them, an update about, how to be a weekend warrior more effectively if they signed up for an orthopedic text message reminder for their virtual appointment. So don't let these opportunities that you now have to communicate with people fall by the wayside. Again, they can opt out, but they may want to continue to subscribe because you probably are creating valuable information that they can use. I probably open 1 out of every 4 emails that Blue Cross Blue Shield sends to me about I have asthma. They send, this quarterly email newsletter. I probably open maybe 1 a year, but it probably has a headline that's interesting to me, or I just feel guilty that I haven't read any others, but they're still getting in front of me 1 out of 4 times. And that's valuable for them to know that they are trying to communicate to a patient with a chronic health condition so that they can help me manage that asthma better. The other way that to communicate with people is to send them information that they can print out and use right before the telemedicine visit, or a few minutes before, or an hour before, or the day before, whatever it is, that really clearly explains how to use it. Because again, content is designed to help people do the things they need to do, and it's also supposed to help the business get closer to its goals and its objectives. So if you're sending them something beforehand to help them through, you are meta messaging to them, we are helpful, we are kind, we are here to help you. Just make sure it's easy to use and read. This was actually from my GI a few days ago when they sent me this how to get in, and I looked at these FAQs and troubleshooting tips. I did read through it because I wanted to make sure that I was prepared for this visit. And it wasn't my first virtual visit since the pandemic started, but it was the first one with him and the first one with this practice. What we found when we looked at a lot of the hospitals and healthcare organizations, including on the insurance side that we looked at, sorry, there's a fly and I don't want to be like Mike Pence during that debate. We found that some organizations didn't take advantage of saying that you can have a virtual visit in case you're worried about COVID-19 symptoms. And so that's another thing. Don't just because you want to, push the telehealth on the primary care or on the specialist side, don't forget that people are really coming because they're like, oh my God, I have a cough, I might really be sick. They might be scared and they may want an evaluation before they go in for a test, because going in for a test means exposing yourself to potential germs. I really liked this COVID-19 self-checker. If you go into the coronavirus self-checker, you now have an opportunity to actually look at the diagnosis and see if you potentially do have it. And this is another way for people to connect to you for future care in the future. So I think that using those interactive tools that you may have can also be a way for you to remind people that you do COVID-19 virtual visits, but also to capture their information and to make sure that you're sending them information about COVID so that they feel comfortable and reassured. And then this is something that Dignity Health does, which is a very large system in California and Arizona, looks like the bottom of Nevada. And they have emergency and urgent care close by, and they have this awesome interactive tool where you can actually search for coronavirus testing locations or treatment locations. So they really found a way very quickly to help people get the care that they need based on geography, which quite frankly, in the case of a COVID urgent visit, might be something that somebody wants. But before you make that appointment, they're gonna let you know that you can be evaluated for those COVID symptoms online during a telehealth visit. Okay, so we've looked at 7 of these best practices. We've looked at, making sure that you have a nice front door, making sure that you use your specialty care, making sure that you're letting people know that, that you have COVID-19 virtual visits available for them. I just wanted to look at 3 examples of best in class who I think do really a nice job of blending together all 7 of the best practices we talked about. So this is Cleveland Clinic. Yes, they're usually one of our best practices examples. They're great at what they do, but they really think it through. And the reason that they're good at what they do is because they know exactly who their audience is and they know exactly what they need. And that's the thing we come back to again and again is if you want to be successful doing this, you must understand your audience. And we're so lucky because we have all this digital monitoring things and social media and call center numbers, and we can get our hands around all this data and understand our audiences better. And so they do a really nice job of having a nice front door. They talk about their commitment. They talk about their frequently asked questions. They talk about, do you think you have coronavirus? And they allow you to go in and figure out how to make an appointment with their Cleveland Clinic Express app. United Healthcare does a really, really nice job here on their homepage for telehealth. They allow you to find the information that you would need about talking to a doctor for telehealth services. They talk about COVID-19 coverage. They have a symptom checker. They have a testing location ability to find one close to you. So they do a nice job of merging all of their business needs and their patient needs in one place. And then Stanford really does, I think, an outstanding job. They have this COVID-19 testing sites. They talk very clearly about what they can provide. They give you an opportunity to book an appointment immediately. They have the specialty care appointments right there online, right there in the book an appointment. And I think that they do a really nice job of taking all of those best practices and putting them into one landing page for telemedicine, COVID, everything that's going on right now. So I promised you a free gift. It's not a unicorn, sorry, but if you find one, let me know. It's an ebook actually that you can download. We're going to send you the link that you can download and is available to you exclusively for the next week. It's called Your Telehealth Program is Now a Service Line. Sound familiar? 7 Best Practices for Long-Term Marketing Success. We go through a lot of the things we talked about in this webinar. We also give some other examples and also highlight some more things that you might want to be thinking about in terms of the kind of content you want to produce and where that content should live and the format it should be in. These are the sources for what I talked about. I know sometimes people want to find out where the statistics are from. They are from these 2 URLs. And I will be more than happy to take questions. Thank you so much for being here. I'm always like so happy to spend time with friends, especially since we can't see each other at conferences. But I do appreciate your time. And Jessica, if there are questions, I'd love to take them now.
Sure. We have a few questions. So one is, how do we differentiate telehealth from virtual urgent care?
That's a good question. So I think virtual urgent care sits inside of telehealth. Telehealth just really, if you look at the definition, means accessing medical care through electronic means. Telehealth is actually started by phone, telephone, telehealth. So there was this idea that doctors maybe could, answer problems over the phone. Any mother who's called her pediatrician in the middle of the night, or father, knows that certainly can happen. So I think a virtual urgent care visit, what was it, Jessica?
Yeah, virtual urgent care versus telehealth.
Virtual urgent care. So virtual urgent care is like my kid has a cough, or, I'm sneezing, or, my allergies are acting up. That's a telehealth. That's a category within telehealth. And I think that that's how you differentiate them. What I did today is not virtual urgent care. I had an annual exam with my gastroenterologist who's known me for years, who has to see me once a year to make sure that I'm following my prescription regimen and that I'm doing what I need to do to stay healthy. He actually told me, don't watch the news. I'm very excited, doctor's orders. So that would not be considered a virtual urgent care visit. That's just an annual exam that was conducted by video.
Okay, the next question. Says, Ahava, I'm wondering if you know what most hospitals are using for virtual visits, Zoom, WebEx, or another platform for specialists doing telemedicine?
Yeah, that's a really good question. So I know Doxy is incredibly popular for those in practice. We've had like 4 or 5 virtual visits with different doctors over the last 8,000 years, and some have been for our kids, some have been for us, and most of them have used Doxy. I know that there are platforms that you might have to use because of HIPAA and PHI. I'm not as familiar with those, but I don't know. It would be a good question to ask on LinkedIn or Twitter. I think people would be more than happy to share that information about who they're using.
Okay, the next one. When you have multiple virtual care offerings, such as on-demand, scheduled video visits, clinic to clinic, e-consult or e-visits, how do you educate your patients to understand the differences between them?
Why do you need to educate your patients to understand the differences between them? That's the first question I always ask. What makes them different from each other? And do there need to be so many offerings? And do they really need to understand the differences between them? So can you read that list again for me, Jessica?
Yeah, on-demand, scheduled video visits, clinic to clinic, e-consult, and e-visits?
Okay, so I would really want to understand what the differences between those are and why they were branded that way and why patients have to understand. If you do have to explain it though, I think you use a table layout approach where you explain, like, you know, in one column, like not pros and cons, but what to expect, platform used, don't say platform, say technology used, and then just explain what the differences are between them. And then don't forget at the end of the row to say, you know, book now for your e-visit, book now for your virtual visit, book now, so that people can decide which one they want, and then they can go ahead and go in. So very often we think education requires a ton of content. It doesn't. It requires a ton of differentiation, and sometimes that's the best way to do it. Remember, the simplest way to express information to people is to give them only the information that they need at that moment to make the decision they need to make. In adult learning theory, there's a fancy name for that. It's called progressive disclosure. So if somebody really needs to understand the difference between those things, explain it as simply as possible.
Okay, the next one. Can you share wisdom about engaging with vulnerable populations, such as those on Medicare or Medicaid?
Yeah, you know, it's funny. That was a question that somebody sent in before, and I actually, in my research, came across some information when I was looking at the SEO research that Medicare and Medicaid came up. And unfortunately, I didn't pursue it. You know, I don't really know the answer to that question because I don't know how the content gets triggered. Are people on Medicare and Medicaid calling their regular doctor to find out if they can do telehealth and if it's covered, or are they going to Medicare or Medicaid to find out if they, you know, are allowed to use medical, you know, are allowed to use virtual visits now? So I don't really know the answer to that question. Whoever you are that asked that question though, if you want to send me an email, I'd love to talk to you about it because it's something I don't know anything about. So I would like to learn more about it. Maybe if you can give me the specific context, we can sort of hash it out together because I would like to know more about that and how that's working right now.
Next question. I work with a large network with many small rural providers. How can organizations without a marketing budget improve their telehealth adoption?
That's a really good question. Back to your audience. In a large rural market, where are people spending their time? Are they still reading newspapers? Are they on Facebook? Do they go to religious institutions and get information there? Do they belong to clubs? You know, do they go to the grocery store? Can you hang up flyers? I mean, sometimes the old grassroots marketing things that we used to use still work. Do they sign up for text messaging? Are they on government programs where you can ask the government to forward email to them or to send them text messages, ads? I mean, there's all sorts of ways. Like, not everything needs to be delivered to people through Instagram or a blog. Yeah. Not that those aren't effective ways, but there are other ways to do it too.
The next one is, what is the single most important thing we need to have on our landing page to convert users to go for telehealth services?
That's a really good question. Probably something that establishes your expertise, authority, and trust. I think people convert more on landing pages with pictures. So your landing page should definitely have a picture. I think you should try to have only one call to action. 2 is okay, but I think there should be a primary call to action. Book now, chat now, schedule now, request an appointment now, whatever it is. And then the last thing that I would say is some sort of short content about what to expect when the actual virtual visit takes place. If it's a 15-second video, say, watch our 15-second video on what telehealth looks like.
The next one is, how can we convince our C-suite in the value of telehealth even after the pandemic is over?
Well, I would ask them for the numbers. I mean, somebody's got them. The CFO should have them. I mean, I would look at the numbers and see, hey, if it's not working for you and it's not bringing money into the institution, then I wouldn't see it as a strategic service line. But it would be hard for me to believe that that would be true. So I think the question is about the numbers. And I think what I've seen more than anything else is that the C-suite is paying attention to marketing and communications in a way that they never have before, with an incredible amount of respect. I always say it's like the least most important thing you know, until you have a crisis or until you need communication with somebody or until you're having trouble, you know, getting people through the door. So I think that now you could go to them and say, listen, there's unbelievable opportunity here. It's growing. Bring them those statistics I showed you. Go to the links I gave you. Read more about it. There's tons of information about it. You know, major medical journals are doing research on telehealth adoption. So it's not just inside of consumerism, it's in academia as well. And talk to them about how they think that they could capture a share of the market by doing this. I think it's going to be very popular. It would be surprising to me that the C-suite wouldn't with the right data and an explanation of why it's so powerful, why they wouldn't put their support behind it.
This next question is about content in general. It says, do you have advice for managing content workflow when content strategy and writing is owned by multiple teams with separate reporting structures?
Sorry, I just took the slide off of my own face because looking at the video was a little much. Here's a pretty picture of the ebook. So do I have advice about, say it again, content workflows?
Yep. So do you have advice for managing content workflow when content strategy and writing is owned by multiple teams with separate reporting structures?
Yeah, I mean, it's a big problem everywhere. You're not alone, whoever you are that wrote this question. I think you have to, when we talk about governance and workflow, they're two totally separate things. What I hear very often is communications owns social media, or marketing doesn't own the web, or IT owns the web, these sort of like crazy ideas about that. And everybody has to get on the same page from a leadership perspective and figure out how to break down those silos and figure out what's in best service to the business, rather than this Game of Thrones approach to who owns what and how do we create workflow that, you know, makes me feel like I'm empire building. The better question is how do we create a workflow that allows us to produce the best kind of content possible? It's very complicated. We have a whole workshop on it, so more than happy to talk to you about that.
This is the last question, unless another one comes in. It's also about workflow. How do you stick to the content workflow when high-level stakeholders such as doctors and CMOs derail the process?
I feel like this should be a therapy session. You know, we should all get together and be like, it's a real problem. I once had a client tell me that she needed Santa Claus and the Easter Bunny to approve her content before she could publish it. I think my experience with C-suite and executives is that they like for the numbers on the bottom of the spreadsheet to be round and green. And if you can go to them and say to them, what we're seeing here is that because we're not able to follow this documented workflow, we're not able to stick to the strategy and we're not being able to achieve our goals. So so this is an overall approach, and then I'm going to give you an approach tactically in the moment. So I just want to let you know that here's why we weren't able to meet our numbers, because we were interrupted from publishing because this person took 7 days to get us an answer when we really needed to do it quickly. At the tactical level, when that happens, you need to say to the executive, if you edit this or change it, you are putting us in danger of X, Y, and Z, and just tell them that right then and there. Another good thing that people need to know is that when you ask somebody to edit something, you should tell them exactly what you want them to edit it for. So if you're looking for grammar edits, then you tell, I'm looking for a line edit. If you're looking for overall brand strategy, is this the brand strategy? Does this sound like it's coming from the right voice? You need to give editors very careful and specific instructions, otherwise they will go to town, because that's what editors love to do. So that's what I would say about how to handle that. It's very complex. Listen, you know, there isn't a business that exists like this in healthcare that doesn't exist in every other industry. Content is really complicated and it's very frustrating sometimes. And I really feel for you, and that's why we've dedicated our careers to trying to make it easier. But sometimes I feel like with executives, you just have to continue to bring them data that shows that their behavior is harming the business. Some of them will hear you and some of them won't. And that's just sometimes what it is to work in corporate America. So I wish I had a better answer, but I think just going to them and explaining to them, this is stopping us from being effective. And then finding a champion. you know, sometimes in an organization, somebody who was wronged by that process actually will become your biggest cheerleader, because they'll say, you know, I was supposed to be able to get this out, or I was supposed to be able to just shoot this through a line edit and then, you know, use it, and you didn't let me, and then this happened. Those people can sometimes say, let marketing communications do their job the way they want to do their job. The other thing I'll tell you is that, you know, in this talking to people in this video series of what did you learn, one of the major messages I'm hearing from, you know, the CMOs and the executives is that agility is what they found out. They didn't have to just like throw everything to a committee before they did it. Like if they had to publish, they had to publish. If they had to get it out, they had to get it out. If they had to talk to the Department of Health, they talked to the Department of Health. And I think that that's a critical thing to remember, is that one of the things you can say is, when we were in the middle of the pandemic, you let us do X and it resulted in Y, which was really successful. We need to be able to do that all of the time, even when our backs aren't against the wall. And I think that might also be a convincing strategy. All righty, thank you so much for being here. Jessica, any other questions?
Nope, you answered all of them.
All right, awesome. I hope I answered them well. Again, if you have any questions, if you want to talk to me further, if you need therapy, trust me, I'm totally there with you. I think we all need a little bit of it. Please do reach out. It's always exciting to hear from everybody, especially, like I said, in this lonely kind of time. You do not have to wait by your computers, but I promise you our magical team of Jessica, Haley, and Carrie will get you that video and the slides, and a link to the ebook, and we look forward to seeing you. We are not going to do any more webinars this year. We think everybody has webinar fatigue, and we're about to hit holiday season. So, but we will see you in 2021. So please do let us know if there's anything you would like us to cover. Thank you so much for being here.